This meeting is being recorded.
Okay, everybody. Nice to see you all. Really good turnout again today. I think it's a good idea, because there's some new people on here, that we all go round and say who we are and who we work for, if that's okay. Yeah. Starting with me, I'm the Admin and Resources Manager for Citizens Advice at Worcester. I manage the case support workers for here and also in Worcester too. Sally, do you want to carry on?
Hello everyone. Sorry, there's terrible echo. Yeah, terrible echo on here. I'm Sally, work for Macmillan Advice, and along with Ange, we take all the referrals for Macmillan Citizens Advice.
I think it's because you're both in the same room and you've got a bit of feedback there. Anyway, Gemma.
Hi, I'm Gemma Insall. I work at Worcester Acute as a Macmillan support worker alongside Ange and Claire. Hi.
Hi. Welcome on board.
Thank you.
Ange.
Morning, everybody. I'm Ange Gillett. I'm the Macmillan Information Support Lead for North Worcestershire, so I cover the Alex and Kidderminster and surrounding areas.
Elaine.
Morning all, I'm Elaine Lowe. I'm the CEO at Citizens Advice Wye Forest, and we have 2 case workers working on the Macmillan project covering the Wye Forest area.
I'd ask Ange, but you just know who she is because you just had the feedback from where Sally is. Sally, Ange is our new case support worker. She's taken on the role from Jill Cornwall, who retired back in May. Ruth?
Hello, yeah, I'm Ruth Hawkins. I'm one of the Macmillan Welfare Benefits team working in Hereford.
Kate?
I'm the Macmillan Benefits caseworker for Worcestershire North.
Neil?
Hello, I'm Neil and I work for Shine Cancer Support, and we're a UK-based charity that support young adults who have had a cancer diagnosis.
You're going to give us a bit of a speech later, aren't you?
I am indeed.
Next.
Thank
Ben?
you.
Morning all, Ben Furlow, Living with and Beyond Cancer Project Manager working at Worcester Hospitals.
Esther?
Hi, sorry. I'm Esther Passingham. I'm the VCS Voluntary Community Sector Strategic Lead for Worcestershire.
And you're going to give us a bit of a chat later as well, aren't you?
Yes.
Lynn?
Hi, Lynn Godwin. I work with Sophia at St Richard's Hospice as their CAB advisor.
Thank you. Lindsay?
Hi, I'm Lindsay Tasker. I'm part of the new community builder team at Wye Forest District Council.
Thank you. I've got a Jay Corrick. Jeanette?
Yeah, hi, I'm Jeanette Corrick. I'm the newest member of the Living with and Beyond Cancer team at Hereford County. So I cover haematology and lung at the moment. So,
Great.
Hi.
Thank you. Tudor?
Hi, I'm Tudor Humphreys and I'm the partnership manager for Macmillan, and I cover Hereford and Worcestershire, Herefordshire, Worcestershire, Shropshire, Telford and Wrekin.
Thank you. Susie?
Hi, I'm Susie James, an engagement officer with Healthwatch Worcestershire.
Lisa?
Good morning, I'm Lisa Rowbury. I'm currently the Macmillan lead cancer nurse at Worcestershire Acute. Morning.
Lovely. Thank you very much. Well, before we go around and say what we're all up to and what we're doing, we've got Neil, who's from the Shine Cancer Support, and he's going to tell us a bit about what his work is. And over to you.
Thank you very much. Yeah, I've got some slides, but I'm aware there's only about 15 minutes. So for the full workshop, people can attend on our website. I think one or two of you have already attended, but we've got all of the list on our website, and that's 2 hours long and CPD accredited for anyone that is interested in that. But let me get started. To share my screen, I think I might need to be made co-host, if that's okay.
Try that.
There we go. Yep. Apologies, you'll just see all my tabs open at the moment. Can everyone see these slides okay?
Yeah.
Okay, so yeah, I'm going to talk to you a little bit about what we do, what the sort of problem is, what the issues are. This is a really condensed version of the full workshop. So as I mentioned, if anyone does want to attend one, there are details on our website and there are details at the end. And I'm really happy to send any virtual materials or paper materials to anyone that would like them as well. We've got flyers and booklets and lots of different things. But yeah,
if you send them to Sally, she can distribute them on the whole list if that's okay.
Yeah, cool. I'll send the virtual ones, and then for any requests of any paper ones, then we can go from there. But so who we are, we're a patient-led charity. Everybody that works for us and volunteers for us has had a cancer diagnosis as a young adult, and I think that is what makes us different. We're coming from a place of understanding. We know how it feels to be diagnosed with cancer as a young adult. As the quote said on the first slide, Kahneman, one of our co-CEOs, said having cancer so young is very, very lonely. And I think that's a real theme within people in this age range. We work with people in their 20s, 30s and 40s. So yeah, I'm going to talk to you a little bit more about all of that and about some key issues, and then about what we do as well, and what we can do to help some of your patients or anybody that you know. We do find that a lot of people find out about us through either being recommended by someone in the hospital or by a family friend. So there's often connections with people, and having the knowledge that we exist can be really helpful. So our vision is we wanted every adult in their 20s, 30s and 40s who is diagnosed with cancer to know that they're not alone, to have the support and knowledge and confidence to navigate whatever cancer throws their way. And our mission is there's never a good time to have a cancer diagnosis, but in your 20s, 30s and 40s, there are particular challenges to navigate, like work, dating, finances, and much more. And we're sort of there to help people get it and understand and kind of help them live their lives as best they can. And as I mentioned, we're a patient-led charity. All of our employees have had cancer, and all of our volunteers, all but one of our trustees is a cancer survivor. And 95% of our volunteers are young adults with cancer, and the remaining 5% are people like counsellors that we sort of employ to help with some of our programs. And all of our programs are co-designed with young adults, so it comes from our community. For example, we've got like a book club and a film club, and they've been sort of things that people within our community have wanted to do. They're also co-designed with experts, so we don't just come up with anything that we fancy. We have life coaches, counsellors, fertility specialists that help us put together our materials in the best way to support these young adults. And some of these stats are really nice to read. So 86% of people who are young adults feel better supported after joining Shine. My own experience, I was a Shine member before I started working for Shine, and I think very adamant that I didn't need support, but then once I met other young people, it became clear that it was really helpful. And I think the main focus of what we do is around peer support, providing good quality information and providing some peer support. So helping some other young adults connect with each other, especially in these times when everybody can be really isolated. Even after the official lockdown is finished, a lot of people are still having to isolate and to stay at home. So the scale of the problem, there's over 30,000 young adults aged 25 to 49 diagnosed with cancer in the UK each year. So it's a surprisingly large number. In our Fuller workshop, we do a bit of a quiz around this, and it's a lot higher than a lot of people think. And it means there are about 210,000 young adults in the UK that are living beyond a cancer diagnosis. And we also recognise that major depression is significantly more common in young adults with cancer. That was within a study from the Lancet Psychiatry in 2014. And the main themes that we focus on are living with uncertainty, fertility, working after cancer, relationships and dating, finances, and caring for young children. So we recognise from within our community, and we've done a few surveys within Shine to see what these issues are, because we knew what they were for ourselves, but knowing what they were for other people really helped us make sure that all of our programs can look at all of these different themes. As I said, this isn't the full workshop. So in the full workshop, we dig down into all of these themes and different charities and different places and different things that can help support patients. But I'm just going to touch on a couple quick ones. So living with uncertainty. So I mentioned as well about young adults with cancer suffering higher rates of depression. And we know that they suffer from loneliness and isolation and anxiety. And with one survey that we did internally with Shine, we found that 50% of respondents had felt that people had avoided them. 74% of people reported feeling anxiety, and 83% felt they had lost a sense of security in the future. So they're really high numbers within there. So in our 2019 survey, we found that 66% had been offered psychological help, which is great because that's been up from previous years. However, as I mentioned, these young adults, they might have families, they might be working, there's other stuff going on in their lives. So 72% of people said that they felt that that support could have been tailored at different times, which is a similar theme with some of the other support offered, that it is really helpful. However, it doesn't work because I have to pick up the kids, or I'm working, or so that is one thing that we do mention to healthcare professionals, that if it's possible to try and manage appointments or manage support at different times that might suit them, that's really helpful. Working after cancer is another one of our themes. So 40% of people in that 2019 survey said they're unable to work in the same way as they had done before their diagnosis. And within the Shine team ourselves, we could see that applied to all of us. I used to run a pub. Our co-CEO, Kynwin, worked in international development. Emma, our other CEO, worked in banking, and my colleague John was a professional actor as well. So everybody's all of us have had to change what we're doing after being diagnosed with cancer. And 75% of people employed said their work has been negatively impacted, which is huge, really. And the one I always find really interesting is that last statistic there, that it says 64% of people employed at the time of diagnosis had a successful return to work. However, if you look at the flip side of that, that's 36% of people. So it's over a third of people did not have a successful return to work, which is really high as well. And we hear a lot of different reasons for that, sort of a lack of understanding, managing fatigue, justifying going on time off, and a real lack of confidence, which is something that crops up in all of our different themes, and something that we recognize it sort of impacts all of these different themes, whether it's dating or relationships or working or managing anxiety. That real lack of confidence does crop up a lot. And then in a survey done by Working Through Cancer, it found that 57% of people, only 57% of people, knew that they were protected by the Equality Act, which is again something that we come up with a lot, where people are really surprised to learn that after a cancer diagnosis, they have a disability for life, and they do have the ability to ask for adjustments at work, and is a really high number of people that just don't know that, and that's possibly one reason why people really struggle going back to work, because they don't know that they can ask for things to help them. And then, as I mentioned, we have the full range in our whole workshop, but I wanted to focus on what we do, pardon me, to support young adults and go through that with you just now. So we've got clubs and networks at the moment. This is all at the moment, and this is current, so we do change things every now and then, but we have virtual local network meetups. So all of our meetups used to be in person. They'd go for a coffee or to the pub or something, and now it's all virtual. However, we are moving into doing in-person meetups as safely as possible. So that is our plan for this year, is to start moving into safe online in-person meetups. Our Norwich network has done a couple, so has Oxford, and we're sort of looking to build that up as we can. But we do have local virtual meetups at the moment. Same with national meetups. We've got a national meetup every month, so that people who maybe don't belong to a specific network, or might feel in between networks, or just want to join something, can meet each other. As mentioned, we've got a book club, a film club, and I think those are useful spaces where cancer is not necessarily discussed all the time, but everybody knows that everybody there has had cancer. So it's not like people have to think, oh, how am I going to tell people this? Everybody does know that about each other. And it's just a nice space for people to then meet each other as well. We've got yoga and mindfulness workshops. They're all recorded and on our website too. So something really key that I think is helpful for kind of referring people to us is getting them to have a look at our website. We've got our breathwork sessions there. We've got loads of personal experiences. And then we've got all of this information on there as well, which I think can be a really helpful start for then sort of signposting people to us. And similar with our online peer support. So we've got a closed Facebook group with over 2,700 members across the UK. My experience is people are always told that they have an incredibly rare cancer, and then within this group they meet somebody else also with this rare cancer, and can then understand what they've experienced and kind of have that peer support as well. We've got a +1s Facebook group, which is for the partner, the family, the friend of the cancer patient. There's about 300 people in that. We have a lifers group, which is for people with an incurable cancer diagnosis. And we do have a dating after cancer and a menopause Facebook group as well. So lots of different groups there for people to sort of get involved in. And then Shine Connect is our annual one-day conference. What we used to do is have a one-day event in London and lots of workshops in the day. But what we've actually developed through lockdown is doing it over 5 days. So spreading it out, having lots of different things that people can join if they want to, but it's all online. So it makes it nice and easy for people to jump into this or jump into that, or they want to hear a bit of travel insurance, or they want to go on this workshop, or and it's really been fantastic actually. We are thinking that at some point, whether it's this year or next year, to do it as a hybrid event. So we don't want to go back to just completely doing in-person stuff. We do recognize the value of online support as well. So we're not too sure whether that's going to be this year or next year, probably next year. But online, it does actually, we've been able to reach even more people, which has been really great. And the dates for that are the 12th and the 17th of November, 2022. And there is a workshop for healthcare professionals. They're always welcome to join as well, find out a bit more about us. And there's loads on, absolutely tons of stuff. And it's all available on our website if anyone wants to have a look. We've got a breakout program, which we've been running since lockdown. We wanted to still create that, that peer support, still connect young adults with each other, even when they couldn't be in the same space. So we developed this program, brings together young adults over 6 weeks. We discuss a variety of topics like living with uncertainty, relationships, similar to the themes that I talked about there. We've had over 70 people join us on on the programs. We've run it, I think six or seven times now. And it's got a really high score. And the next one, we've got it starting in May there, but the next one I think is September. Again, all available on our website for people to apply to. So really good to signpost people onto this if they have had a cancer diagnosis and they do feel like they'd want to talk about living with the impact of it. Our Circles program is in two allocations, one for people with a incurable diagnosis, because we recognize that some people with that diagnosis want to have a different space to talk about it. And one intake is for plus ones, so the partners of people that have had a cancer diagnosis. Again, we've reached over 70 people. And yeah, next one starts in September as well. All available on our website if anyone wants to have a look. And as I mentioned, yeah, that's the plus ones intake there as well. We have a newly diagnosed booklet. I can send this in a virtual copy, and I can also send it in paper copy as well. I'll send all these materials on, I think it was to Sally, I heard. And if anybody does want any paper copies, please do get in touch. I'll also send this presentation if anyone wants to kind of go through it as well. And then we've got a Living with Advanced Cancer booklet as well. So both of these booklets were designed with young adults. So they've been designed with young adults about what they wish they'd heard originally, what they wish they'd been told. And we've heard how helpful it can be. It's been really successful since we've started sort of sending them out and printing them. And then, as I mentioned, we do have training for healthcare professionals. We've got a 2-hour workshop. It is online, CPD accredited, totally free, although the certificates are £20. We've got the next one coming up at the end of June, then July, and we've just added a load more dates for the rest of the year. So all of that can be found on our website. The details should be, on the next slide. So as I said, I'll send this round so you do have all of this information. But these are all our contact details, and if you do want to sign up to one of our workshops or find out a bit more about us, you can download both the previous booklets off our website. There is our podcast there, we have blogs, there's just loads of materials and support there. So I definitely recommend signposting people onto this. But yeah, I hope I've not overrun, but I think that's my 15 minutes. But if anyone has any questions, I'm happy to answer any.
Yeah, carry on. That was really interesting. I think it's something that we all can focus in and refer to, and hopefully you can refer to us. Once you listen to what we're all doing, you'll be able to refer into us as well.
Neil, can I ask a question?
Of course.
How would you feel about doing a presentation to the family support team at St Richard's?
Yes, I'd love to. Yeah, we're always keen to do presentations to people and kind of get the word out about us, because the main thing that we always hear from people is they say, I wish I'd found out about you sooner, and I wish people had known about you sooner. And we're a tiny little charity, so I think that's our main focus is getting that word out. So yeah, I'm going to put my email address in the chat, and then yeah, just give me a email.
Lovely.
And I work 3 days a week, but if I can't do it, one of my colleagues will be able to. So
Fabulous. Thank you.
Just like to say that I've been on the Shine study days, and they're really brilliant. So I heartily recommend them.
oh, thank you.
And it refers so many people to you, because it's such a the needs of that age group are so different, as you said in the presentation.
That's lovely, and I think it's so great when we see people that have been given information by a nurse or by someone in the benefits team, or some person that they've been in contact with throughout their journey, as opposed to people who have found out about us themselves through Google, and they've been like, but I've requested help with this and I don't understand why that's not come. So I think knowing about us is a great start, and referring people, that's great to hear. So thank you.
Anybody else got any questions? It was really interesting and shines a light on what we didn't know. Really good. Esther, would you like to carry on, or do you want to do yes, is that okay?
Yeah, that's fine. Thanks, Nikki, and thanks, Neil. I did some work with Penny Brun, supporting parents whose children, teenagers, had got cancer, and worked with the Teenage Cancer Trust, and came across Shine a while ago. So it's brilliant to find out more on the amazing work you're doing. I'm afraid my subject's slightly drier. It's not. It's maybe not. For some of you, I hope it's going to be of use. And sorry to Susie, you've heard this presentation a few times. So can I share screen? I think I can. Yeah. Right. So as I mentioned in the beginning, I'm the voluntary and community sector strategic lead for Worcestershire. So I'm employed by the Chamber of Commerce, but that's just as a hosting sort of practical role. My post is funded through the County Council and the NHS, but it's very much to be sort of working with the voluntary and community sector to develop an alliance, which I'll talk about in a little while, and also to talk about what the voluntary and community sector might need going forward, and how we can develop services particularly around health and well-being. And this is really the catalyst for this has been the introduction of the integrated care system, which I'll talk about in a bit more detail as well. But I thought firstly, just to give you a bit more of an insight into what my role is, in case this is of use to you in your roles. But yeah, so what my main objectives are to develop projects and partnerships between the voluntary and community sector and the integrated care system, with the aim to create positive health and wellbeing outcomes for people in Worcestershire. So that's sort of the one of the main focuses. And as I mentioned, to develop this new model of working with a Worcestershire VCSE alliance. And then from that we are hoping to collate and disseminate a lot more health and wellbeing information that we can then analyse and look at where the gaps are in services and where additional resources need to be focused. And then also disseminate this information so that there's more communication about what's happening and where across the county. And then where there are gaps and things that need to be developed, find investment to build the capacity of the sector. And again, this is all to enhance health and wellbeing services in Worcestershire. And then sort of coming later on, we're going to be looking to work with statutory partners, we being the alliance, to work with statutory partners to develop a different way of commissioning. That's the aim, So we're not being, as voluntary and community organisations, not being put up against each other in competition as much, but more about collaboration and finding ways of working together, and just really improving the way work is commissioned through statutory partners, and building into that a social value framework. That's the main purpose of my role, the main aims and objectives. So, but talking a bit more about what the integrated care system is, I don't know if many of you have heard the term and understand it, or maybe just heard it and haven't really got much information, but basically the clinical commissioning groups are stopping at the end of this month. They're going to be all finished, and people are being tupied over, staff are being tupied over to the Integrated Care Board, which is one of the components of the integrated care system. It's the Integrated Care Board has the statutory duty that the CCG used to have, along with other statutory duties. But this is the description on the King's Fund website, and the King's Fund has got videos and a lot more information that's really useful, describing how this new system, this new way of working is going to be rolled out. So Herefordshire and Worcestershire is one integrated care system, and so what we geographically based partnerships that bring together providers and commissioners of the NHS services with local authorities and other local partners to plan, coordinate and commission health and care services. So we all are working towards one aim of improving health and well-being of our population. And so as the voluntary and community sector, we're a really key partner in this new way of working from the 1st of July. So just a little bit more about Herefordshire and Worcestershire integrated care system. So as I mentioned, it's a new NHS statutory body and encompasses 3 NHS trusts, 7 local authorities, 15 primary care networks, 80 GP practices, etc. So it's really pulling all of that together into one system, and the aim is that it becomes more joined up. And we work together more seamlessly as partners. And I'll send these slides to you so you can have a look at this if you're interested in the detail. So a bit more about what they're hoping to achieve, what the NHS is set out for partners to achieve. So the duties are to improve outcomes, tackle inequalities, enhance productivity and value for money, and help the NHS to support broader social and economic development. And there's more detail under each of those that you can read at your leisure if you so wish. But it's really all of the things I'm sure you're very aware of. But it's hopefully, I mean, it's a big ask. I think there's it's such a complicated system, but the aim is that gradually things become simpler and more streamlined. So there are these 4 components to the integrated care system, as I mentioned: the Integrated Care Board, which is the statutory body, the provider collaboratives, which are NHS trusts working together more collaboratively, and the Integrated Care Partnership, which is a new statutory partnership between the ICB and local authorities, and focusing on wider determinants of health. And then a place-based partnerships and district collaboratives. So for Worcestershire, there'll be one partnership, and that will encompass, hopefully we'll have the voluntary and community sector will have at least 1 seat on that partnership. That is to be decided still, but that's what we're hoping for. So why is the voluntary and community and social enterprise sector so important to the integrated care system? And this has come from the NHS. So this is what we are looking for, to become equal partners in the integrated care system. So the sector provides specialist expertise with fresh perspectives. I don't need to tell you, those of you who work for the sector, that is absolutely the case, and that often voluntary and community organisations are able to find more creative ways to improve health and wellbeing outcomes. We provide expertise in service redesign and delivery, and help to address inequalities. We also have access to volunteers and premises, and we're well placed to engage and support people with complex and multiple needs. Providing early action and preventative services that are quality and of value for money. So I know, this is what a lot of you do, and this is why we are such a key component in this new way of working from the 1st of July. So I mentioned about the VCSE Alliance for Worcestershire, and this is a model that we have developed, a proposed model we've developed for Worcestershire of how it's going to work with the partnership. So Herefordshire, I know there's a few people from Herefordshire, it's been developed differently there because obviously it's different geography, different needs. So, but even though we're one integrated care system, this is specifically for Worcestershire. So the central box is describing about the type of representation that we're developing for the sector on this new alliance, which in effect is sort of a collection of leaders from organisations working particularly in health and wellbeing across the county. So we're looking at having the managers or senior leaders from the local infrastructure organisations, so the Council for Voluntary Services and volunteer centres. We're having people who are running health and wellbeing services across the county, that their senior leaders or managers or CEOs will be part of the alliance, and then organisational leaders from communities of interest or protected characteristics, and also making sure that we've got that really strong link with the Health and Wellbeing Board. And that sort of leads us on to that bottom left-hand box, where there's lots of health and care partnerships and boards and committees, and it gets really confusing, and the voluntary and community sector aren't always represented on these boards where decisions are being made. So the aim is that people on the alliance or people from the relevant work streams that are going to be developed sit on the relevant boards or committees, so that we have really good representation at all of these decision-making boards and committees. So that's really important part of this work as well, is to make sure that the voluntary and community sector are represented and are equal partners across the whole system. And I mentioned these work streams. These are to be decided once the alliance starts, which will be in July. And it's really going to focus in energy and invest in the areas that need developing. So, for instance, children and young people's mental health or volunteering. Those are the sort of things we're looking at, how we can develop those areas which need extra investment. But it will be for the people on the alliance to come up with what work streams we're going to start with. And then the boxes across the top, they're really focusing on the district collaboratives, which some of you may have come across, which have already started or starting. And these are the partnership arrangements at each district level across the county, where the population health management work is being done with the primary care network and with district councils and the voluntary and community sector. So ensuring that the alliance is represented at each of those district collaboratives and feeding information in both ways in and out of the alliance. And that people who do sit on the alliance will be able to really be advocates for the sector and be representative and provide that broader perspective of their area of expertise, that we can really develop this collective of people to look at how we can develop the sector across the county. So as I mentioned, this is the sort of timescale. We have been co-opting representatives onto the alliance already and having conversations. We've got a workshop coming up next week where we're going to be looking at the governance and the memorandum of understanding, and then we'll have our first official meeting in July. So that's what's happening. Stop sharing, and that's that's what's happening to develop this new way of working from July. So hope that made sense and wasn't too boring.
No, it's fine. Is anybody, thank you for that. How long do you think it's going to take from July to set it all up?
Well, the Alliance will start from July. So we've co-opted a number of people onto the Alliance already. Because we haven't got a structure in place to vote people on at the moment, we've had to use a co-opting method, but the plan is in the future that we'll develop ways of the sector voting the members on, but that is to be developed. It's really, I think, really important that those who sit on the Alliance have got that mandate from the sector, but it's just something we've got to work towards. We've got to start off in this way, otherwise it's really difficult to get going, and we only had a short time scale to get things set up. So we've got a range of people who are coming on from the 1st of July. And then we're going to have a comms and engagement person work with us who will be able to really help work with me to develop a website and make sure that we're getting information out to everybody about what's happening, so we can keep you updated, and particularly sort of around funding and commissioning and all the developments that are happening there, and just how the sector are working with the statutory partners and any important decisions that are being made or need to be consulted on, so we can ensure we communicate that with everybody, or as many people as possible.
Okay, and you say that Hereford, is there a U in Hereford?
They've done it differently in Herefordshire. Is it Lindsay? Was it you? No, is it Lindsay? It's from Herefordshire. Ruth. Sorry, Ruth. Yes, so I'm not sure if you go along to the community partnership, they call it, and it's a wider group. There's generally about 50 or 60 people that attend their community partnership, whereas there'll probably be about 20 people attending the Alliance in Worcestershire. And in Herefordshire, Health Watch and HFOS, which is their infrastructure organisation, are leading on this area, on this work. So the CEO of Health Watch is really involved in Herefordshire.
I think Alison might be able to shine a light on this. Alison's from the pod over at Hereford.
Yeah, I am.
You missed it. You want to say who you are first of all?
Yeah, sorry, I was late. I think we've got thunder and lightning in Herefordshire, and the whole of the internet went down for a while here at the hospital. So I'm Alison Stemp. I actually have two roles at the Wye Valley NHS Trust. So I half the week run the Macmillan Information and Support Service here, but the other half of the week I actually job share Patient Experience Manager. In terms of, yes, we do have a community partnership in Herefordshire, which was set up by Health Watch, and we have very good links here with Health Watch and also HFOS, who are the voluntary services organisation locally. And in addition to which, there is also an engagement network that's fairly embryonic but being set up across Herefordshire and Worcestershire, which is specifically around patient engagement, but cuts across the whole ICS footprint, and a lot of the same organizations are also involved in that. So a slightly different model, but definitely a much more coordinated move to working much more closely in alliance with voluntary sector.
Okay, thank you. Has
Yes.
anybody got any questions for Esther?
Just to say, obviously, Health Watch are a really important partner, and Susie and I have met, and obviously with Simon Adams. But it is being done differently here. Health Watch are very clear, aren't you, Susie? I don't know if you want to say anything. It's a really clear in Worcestershire that that this particular piece of work is separate, although joined. but there may be down the line, because there is another piece of work around communities and people where that work is still to be developed. So this is based on a white paper that's about particularly about the voluntary and community sector. And this is what we're focusing on first in Worcestershire, whereas I think Herefordshire have looked at both white papers, the one around the voluntary and community sector, but also people and communities, and they're sort of looking at joining both up both of their guidance is being joined up in Herefordshire to develop the way they work. Whereas for us, it's very, we're just starting with the voluntary and community sector, and then we'll move on to communities and people, and I'm sure there'll be lots more discussions with Healthwatch at that point.
Do you want to say anything, Susan?
Yeah, sure. Yeah, no, I absolutely echo everything Esther has said. The model in Worcestershire is very much focused on creating a kind of like a bigger body for the voluntary and community sector to come together initially and be part of the ICS, which is exactly what's happening here in Worcestershire. But yeah, we talk with Esther and looking forward very much to working perhaps, going forward in the future on a second phase and seeing how that we can work more closely. But Healthwatch in Worcestershire are purely focused on gathering patient and public feedback about the services they use, the NHS and the social care services. And we kind of like sit at the moment a little bit, we're not really part of the voluntary sector. We're definitely not part of the statutory sector. We're not really part of the voluntary sector. And we kind of like sit in this slightly strange position. We are very much in step with all the developments that are happening that Esther's leading on.
Okay, has anybody else got any questions for Esther at all? No?
Were many of you aware of this change that's happening in July with the integrated care system? Yeah. No, I think it's obviously, I think the NHS particularly have been so sort of all the transformation and strategic people are all looking very inward at the moment at making these changes. But from the 1st of July, when it actually starts, it will start to become, there'll be a lot more communication about it. And I know there's a website that's just been launched. So there'll be more information about what's actually happening in Worcestershire and how it's going to affect potentially some of your work. But at this stage, it's still all being worked out, really. I think there's been so much to do. Maybe I could send the link to the integrated care system website along with my presentation. Is that okay?
Yes, if you send it to, if anybody's got anything to send, please send it to Sally. She's likely to be inundated, but she's got a whole distribution list for who are on this group, so it'll get out to everybody then if you do that, or any of you do that. I was going to ask how we were going to find out more about what you're doing and when things are happening and whatever.
So I mean, I'm happy to come if people are interested, would like to have an update maybe in 6 months when more things have been implemented. Hopefully it will be a bit more relevant to your work by that point.
Yeah.
So maybe if that's okay to come back in 6 months and let you know what's happening.
Yeah, that'd be great, please.
Thank you.
Okay, well, I think that's both the little presentations that we've done, which I think has been quite useful for all of us. So now I'd like to go around and ask everybody just to give us an update of where they are and what they're doing, if that's okay. Ange, if you'd like to start off, please.
Yeah, morning again, everybody. I think it's about to absolutely hammer down here. It's gone very dark. Morning. So I am the Macmillan Information Lead for North Worcestershire. So I cover the Macmillan Information Hubs at the Alex and Kidderminster. As we all know, as we've said on the previous meeting, service is very, very busy at the moment. And I think the complexity of the type of people who are accessing our support, late diagnosis is certainly becoming more apparent. And I think just the last couple of weeks, it's occurred to me as well that you sort of people that would normally cope okay with treatment, I think from a mental health point of view are really struggling. And I think that's probably you know, and I haven't looked at any research, but just my thoughts are, because of the isolation, going through the treatment, being isolated in COVID, I think it's now starting to really tell. So I think it's been really interesting, you know, listening to Esther this morning about the really huge need for health and well-being going forward. And I think we can already see that services that we use, which is obviously CAB, our psychology service in the trust, are really, really stretched. And I think it's just probably the tip of the iceberg at the moment. So for us as a service, Worcestershire Macmillan Services in the Acute Trust, we're really lucky because we've got Ben in post who will tell you about what he's doing. We've been really lucky to appoint 2 support workers who are going to be working with us and Ben, and also we've recruited a new Living With and Beyond nurse. So I feel that we're really, really fortunate with these new posts. You know, we're already starting to see, you know, some really lovely teamwork, which again, I think Lisa will tell you more about. So going forward, I feel quite positive and optimistic. Gem has been in post, is it 3 months now, Gem, and is absolutely storming. I think it's been really good for her to work in the pods to get that, you know, real feel of, you know, the nature of the work, and then she can go forward and support Ben and Claire, who are the wider team. So she's doing great guns. I think it's been a bit of a baptism of fire, to be honest, but she's coping really well.
I'm loving it. I'm still learning loads, but I'm loving it.
Brilliant. And we just recruited the support worker to work with me in the north of the county. She was appointed last week. She's a lady who has worked in the chemo suite for many years, so lots of experience of cancer patients. So I'm really confident she'll be able to hit the ground running. So yeah, things are really positive. Another bit of good news yesterday: volunteers were allowed back into the trust. We got the green light for that officially yesterday, so that's really going to help shore up the you know, the presence in the pods. Obviously for me, I'm trying to cover 2 pods at the moment with just me, which is impossible. So I really want to put a lot more resources into Kidderminster and Wyre Forest. And I think being on this meeting's just made me think it'd be really nice to get out and meet, you know, meet people as well, and really get those connections going. Which
And will that mean that our caseworkers will be able to come back to the pods and see clients there?
Yeah, I'm really hoping so, Nikki, because I think I can't see any reason why, if we're you know, why wouldn't we be able to go back to normal? So I will certainly be looking at that. There's still the ongoing issue of chemo going back to the Alex. That's, you know, in negotiations, because everything at the moment is still at Kidderminster, all the chemo for the north of the county. But again, Lisa might be able to fill you in more on that. But yeah, Nikki, I think that's really essential to get that, you know, that face-to-face working.
I think it might perhaps be worth us having a meeting on our own with you, me, Sally, and perhaps Elaine or Kate and Andrew, so that we can talk about how we go forward with that. That's okay with you?
And I think there's going to be quite a lot of hybrid working, isn't there? Because I think we've all established that this kind of meeting is fantastic online to save us all, you know, traveling. But you know, I think the face-to-face element is still really important. So volunteers coming back, I think I'm going to have to do a lot of volunteer recruitment, certainly in Wyre Forest. A lot of the volunteers at Kidderminster aren't coming back, and I think for very valid reasons. So I'm going to be looking at a recruitment there, and quite a few of my Alex ones are coming back, so that's positive. Wise, again, Ben will fill you in, but we've started doing the Hope course. The Hope course is all to do with people living with and beyond cancer, and we've started that back up face to face. In fact, it's the last one of the first one today, but we've got more booked for the summer and autumn, so that's really positive. So yeah, we're really busy, but you know, I'm glad we're here. And just on a personal note, I'm going full time as well, so that will be an extra day, which will be good.
Yeah, that's great. I don't know, Sally, do you want to fill us in with, as a result of everything that's happening at the hospital and how we've increased our referrals?
Yeah. Hello everyone. So myself and my colleague, we take all the referrals from patients and professionals that go to our Macmillan Citizens Advice Benefits Advisors across Worcestershire. And we've had our busiest ever month. So between myself and my colleagues, we've taken over 80 new referrals, plus returning clients, plus other inquiries that we've signposted. So the caseworkers between them have done 78 brand new referrals, which is just our record. Like Ange just said, a high level of terminal clients and clients with complex issues and other complex health issues and very distressed family members. So I particularly wanted to thank Claire, Arthur and Ange Gillett and Gemma Insel from the Worcestershire hospitals, and also Paul Litchfield from QE Hospital, because we're referring back now to Ange and Claire, where we're picking up needs that are beyond the benefits advice that we're offering. So a lot of teamwork going on to provide that whole support for patients. So it's been fantastic. And Claire particularly helped with one very difficult and complex case where there was some safeguarding issues as well. So thank you to the team. It just makes such a difference. And we are now offering face-to-face appointments, either the office or home visits, as well as continued telephone appointments. And sorry, I missed the conversation with Ange, but I think Ricky's already raised it about easier contact with inpatients, because again, we've seen an increase in number of inpatients being referred to us. And also to say what a difference having a support worker has been at the Worcester Hospital. Thank you, Gemma, because it's really noticeable. There's been a massive increase in referrals from the hospital. Not that we didn't have them before, but now even more. So it shows there was a need. So thank you.
You're welcome. Thank you. It's been great.
Thank you.
And I think probably going forward, we're going to see, you know, that increase even more when my support worker starts. So
Yes, we're working on that. We're just going to see how it plays out for the next 2 or 3 months, whilst you get your person on board. As Sally said, we're really inundated. For Ange, our Ange, who's taken over from Jill, as she's had a baptism of fire as well. It's been incessant telephone calls ever since she came. And Lorna has also, she fills in sometimes when Sally's on leave. And for both of them, it's just been amazing. The volume.
Sorry to interrupt. I think it's been really important as well that, you know, when we're doing referrals, we say, you know, we check in with each other. You know, we're really conscious that we're handing over really difficult stuff. You know, lots of people with really small children. I mean, a whole range of stuff, and I think the teamwork is absolutely incredible.
It is.
You know, it comes back, you know, to you guys too. You're amazing.
Thank you. Okay, Lindsay, would you like to?
Yeah, I'm just aware that Lisa has her hand up.
Oh, sorry, Lisa.
Hi, sorry, Lindsay, sorry, just to cut in. I just wanted to say how wonderful it is to have our support workers, you know, at Worcestershire Acute. Gemma's doing an absolutely amazing job, and we're looking forward to welcoming Kim very, very soon. But it was just to sort of reiterate really that, you know, they are part of the wider work that's being done with Ben. Ben may have an update later on. Part of their funding was from the Living With and Beyond support from Macmillan, really. So, you know, there is lots of work to be done with them, and they won't just, you know, we are calling them support workers in the hub, but they are not just to be in the hub. So I just wanted to say that their work will be a little bit more than that. It's not. Tudor's on the call, and I know Tudor will be reminding us of all of that as well. So they are doing some fantastic work with Claire and Ange, but Ben may well want to fill you in a little bit later with his plans with Gemma and Kim as well. So just wanted to say that.
Thank you. Thank you. Ben, do you want to then? Sorry, Lindsay. Let Ben, because they keep mentioning him all the time.
Yeah, sorry, I keep on my name because I'm getting dragged through the mud here.
He's worth mentioning. He's worth mentioning. He's a good resource.
Yeah, so just to sort of follow on from what Ange and Lisa have said, is I think we're just to echo Ange's comments, we are very lucky. We are building a really good team around us now, and we've got some really good support. It's great to have Gemma on board. Obviously, we've got Kim starting soon, and we've got another CNS starting. So what I'm sort of working on at the moment is we've had a couple of wellbeing events for patients face to face, which have been brilliant. We did one on Monday at the Pear Tree at Smite. We had, I think, about 70 patients there with some patient stories, and we had somebody from the psychology service come along and do a talk, which I think was really useful, just echoing some of your comments already about the sort of the mental health aspect. So just to sort of, it's just to give patients awareness of what is out there, because I think there's so much support out there, and I know you guys are absolutely batting off referrals because you're getting them through, but it's just to make sure that patients are aware of what is out there, because a lot of patients aren't aware of that. So something else I'm looking at the moment is to develop an app for patients to basically bring all of those support services into one area, so they can find it all in one place. Because I think they get so much information, whether it be a leaflet or go look at this website, go look at that website. If we try and put it all in one place, it's accessible by them, but it's also by their the wider sort of their carers or their family and friends as well, so they know what support they can get. And then another sort of level of that is we're going to sort of be able to ping out when support groups are coming up, so they know what's happening in and around them to support them going forward. And it was I've got a bit of a request for someone, please, to attend young person's bowel cancer support group to talk about benefits, if someone would like to put their hand up. No pressure. It's
whereabouts is that? Because Andrew is currently, he's about to do a talk at for Herefordshire.
July the 13th at the Swan at Whittington.
Okay, well, Sally,
so
can you make a note, and we'll have Andrew's on leave unfortunately this week, so
okay.
But as he's already probably got something already scripted out, which he quite often does these talks, so I'm sure.
Brilliant.
If it's him.
Volunteer him anyways, because you can't say no, so thank you, that's great.
Exactly. I mean, you can't say no anyway, but you know, whether you drop him in it or not. Yeah,
so I think with the having the face-to-face groups with the patients, I think has been brilliant. They just feel, coming back to, I know Neil's dropped off the call, but it's about that community. And I've like Andrew, I've attended the Shine workshop, and I highly recommend anyone attending. They are really good, and they are a really good resource to get out to patients to support them all their different needs. I'm trying to think what else. So the holistic needs assessments, we're trying to sort of bring a standardized approach to that. Ange and Claire have done an amazing job with it, but we're finding that some services aren't using them with patients as much. So we're trying to standardize that approach. What this will mean is then referrals, I imagine, are going to go up even more, we think. So sorry about that, but it's important from a patient point of view that they are offered these assessments, so they know. So they are telling us what is their biggest problem issue at the moment, so we can signpost them in the right way. So we're working on that. We're looking at getting in the electronic holistic needs assessments as well. So it just means it'll be done in a more timely manner, because with the paper copy it goes out, then it's posted, and then from a patient's point of view, that timeline can just be extended when it's something they need to know straight away. With the electronic one, we're hoping that we can implement that, and it would just be a quicker turnaround from a patient's point of view. Sally, what time? 6:30, Sally. Food is provided if that's a sweetener. Yeah, I think that's about it at the moment. It's mainly the wellbeing events we're doing. We're Angela and Lisa have talked about doing a sort of big wellbeing event day in October, I think we said, Ange, to try and support all cancer sites. So we're still trying to sort of flesh out how that's going to work. But it might be that we ask a couple of you to attend, just to do a sort of a talk just to patients. We're going to have to try and think about time to do some workshops or some breakout rooms, but we're still trying to sort of work that through at the moment. So there's a lot of exciting stuff going on at the moment, and very lucky to have such an amazing team around me to work with. So yeah, thank you. That's it from me, I think.
Thank you. Thanks very much. Anybody got any questions for Ben before we move on? And I will go to Lindsay this time.
Oh, thanks very much. So I'm kind of really just finding out what these meetings are about and what's going on. I'm part of a new team of community builders for Wyre Forest, although there are community builders kind of sprinkled across Worcestershire, and we'll be out and about kind of talking to residents and trying to kind of get people interested in doing more for themselves in their communities. So I guess for me, it's about being aware of the kinds of support that are out there for cancer sufferers, so that we can know where to signpost people, because oftentimes there might be some signposting to do. So yeah, I'm kind of just taking it all in, and probably not much help to anybody at this point. I'm new in post and new to Worcestershire, so yeah, just kind of finding my feet. But thanks for having me.
It's okay. I hope you're finding them useful. Okay, thank you. Ruth, would you like to give us an update on Hereford, whether you're getting as many referrals as we are?
Yeah, well, we've been kept busy with a steady stream of referrals. I don't think we've had quite as many as you mentioned. Issues we're experiencing is sort of long benefit processing times with DWP. And we've had quite a high number of cases that have multiple complex issues, which are quite time consuming. We have started to offer office interviews and home visits to our clients, but we have noticed there is some reluctance to accept sort of face-to-face meetings because of their ongoing health issues and treatment.
Okay, thank you. Alison, do you want to follow up with what's going on in Hereford from your end?
Yeah, happy to do that, Nikki. So in Hereford at the moment, in terms of the information and support service, there's only me working part-time. I historically ran the service originally on my own with just volunteers, and 3 years ago dropped half my hours to take up the other role that I do. I've had a band 4 support worker in, but she moved into another role in December time, and due to restructuring the line management alignment of my role, there's been some delays, so the post hasn't been recruited to, so we still have a vacancy here, which is obviously difficult to balance all of that. So I've changed my working hours temporarily to work mornings only, so effectively there's only someone covering the service in the mornings. The good news is that I've now got a couple of volunteers back in. One is one of my original ones who's been with me for 11 years. The other one is a new chap, but he's doing 2 mornings a week. So we do have volunteer cover 3 mornings a week now, which is great. Unfortunately, one of my other volunteers got a job. One's taking a break at the moment due to family issues, and another one has some health issues. So we're gradually looking at trying to recruit a few more back into the service. So obviously people can access the service themselves, but out of when I'm not here, but we no longer have leaflets on display because of infection prevention concerns. you know, as echoing what everyone else says, it is actually, we're seeing the people we're seeing often are a lot more complex, with a lot of needs, and there are a lot of, it feels like anyway, a lot of late presentations. One of the things which you've already mentioned, Nikki, we've got Andrew coming to do a talk for us. So one of the things that we have done is launched a virtual, what we're calling a patient information group. And Andrew's will be the third session that we've run. We did one on eating well with cancer. It was entitled Banishing the Myths, and then we did one on getting active and managing fatigue, which we used some of our new Macmillan AHP roles to provide those talks. And the next one's on Money Matters, which Andrew's doing next week, I think it is. And then we're gradually putting a few of those in as a pilot and evaluating as we go. What we've done as well, the first one was just done on Teams from this service, but the last one we did our first live stream in conjunction with a GP surgery, and we actually live streamed supported by a care coordinator and social prescribers and our GP lead into one of the surgeries in Herefordshire. And if this is successful, we hope to roll this out across other surgeries across the whole of the county. The theory being that we can then make sure that we're not excluding anyone who has difficulty accessing digital formats, and also that we can then build on that by people being able to not have to travel, still being able to access the information, and those who do choose to go into the surgery to listen into the talks can then actually meet, have a cup of tea, and maybe form some little social networking groups as well in their own local area. So that's the theory and that's the aim. So we're very excited about this. We're gradually ironing out a few technical issues as we go, but so far the feedback has been positive, and as I say, we're hoping to build more on that. We're still aiming to relaunch Look Good, Feel Better Soon, which is the makeup, for anyone on the call who doesn't know what that is, they're a charitable organisation who offer complimentary makeovers for ladies and gents now as well. And we are working with a local medical centre to provide it on their site and off-site from the hospital. So each time we've tried to relaunch this, another COVID wave's happened. So fingers crossed, we're not going to have another one now, and we can get back to doing that face to face. So we're gradually putting in some of those layers of support. I think Jeanette's on the call as well, who's we have a number of support workers who they're not directly part of the service, but they work more with the clinical teams to provide the holistic needs assessments. And I think Jeanette's on the call as well, so she can probably tell you a little bit more about that. But we're gradually trying to build that broader Living with and Beyond Cancer team, now that this service is back under cancer services and within that wider team. So we've got our AHPs, we've got our support workers, and we've got the information and support service, hopefully all coming together to take things forward. There are some hope courses being run through the support workers at the moment, but that's a slightly limited offer at the moment, but the aim is to expand the number of people that are able to facilitate and offer that a little bit more widely. There are some structural changes happening in certain areas and for certain groups of our patients, where due to staffing, some of our patients are going to be coming under different hospitals now, and we're reducing the level of service we can offer to those groups of patients in Herefordshire. So we might find that I think a number of our patients might end up coming more under the Worcester umbrella, but living in Herefordshire. So that might be where we need to look at maybe some working together and a bit more joining up and thinking about how best we can serve those groups of patients, because they'll be Herefordshire residents but going elsewhere for treatment. So that's something we might need to have some conversations about.
Yeah, that's absolutely fine. Thank you. Anybody got any questions for Alison? Alison, the same question to you. Does that mean that our caseworkers are going to be able to come into the hospital?
We are working on that, Nikki. Yes, we are. So we've got, I think Ruth has her honorary contract in place, and Vicky's is just being sorted now. So we can as soon as we can iron out the logistics, yes, they can come back in, and I've got the agreement from the senior sister here that that we can do that. And it may be that those people who are reluctant for the face-to-face consultations elsewhere, and maybe be reluctant, maybe having people into their home, might feel more comfortable in the hospital environment. I mean, we are still masking. We haven't had any advice to the contrary yet, although I think Gloucestershire have changed some of their advice in the last week. I suspect, though, even if the hospital more generally reduces the requirement for masks, that I think that will remain. We haven't got any confirmation, but I think that will remain in oncology. So I think, come what may, we will still be masking in this unit.
Okay, thank you. Thanks very much. Tudor, do you want to give us a bit of an overview for Macmillan, please?
This is my second day of listening to talks about ICSs, and a group like this, I think they really need to know about, and it's got fantastic potential to inform the ICS without creating anything new. I don't know if that's your view, but I think this is a really special group. It's not something that's everywhere. Not all of my colleagues have a group that kind of self-manages like this and in such an effective way. So I just want to encourage you really, and thank you, Nikki, for continuing to chair it and lead it and put all the background work in, because I do think these new systems come and go. And yesterday they were saying we're not calling it a board, it's basically going to be called such and such NHS, the two counties and the NHS, and that was it. They're not calling themselves a board. So they will all be created slightly differently, but after a while, I don't think we're going to notice that much difference, because they are basically the joint CCGs. That's the board, whatever they call them. So, but I do think it's really important for a group like this to have its kind of communication continue with that system as it progresses, because at the moment it's just really not clear what difference it's going to make to anybody. So I just wanted to say that at the beginning. Neil from Shine talked about ensuring young people living with cancer get the support, knowledge and confidence to live well with and beyond cancer. And I think that's probably the same for everybody on this call. It's a really good network, all with that kind of common interest. So it was great to hear from Neil. And I suppose looking at this, when I look at my screen now, it's great to see the new team, the new Macmillan team at Worcester Acute, with which Ben is leading, and to hear the really positive impact people like Gemma are making already. That's a £250,000 investment. So my job for the last 2 years has been pretty much sitting behind screens like this. I used to travel around everywhere. For the last couple of years, I've been in my cell and I've been staring at screens, trying to keep that communication with leaders like lead cancer nurses and managers of voluntary sector organisations, to see where we can collaborate, where our strategies line up. So to see that idea, which has been bouncing around for quite a while, really come together in a new team with a project manager, a lead CNS and 2 support workers, and to hear early news that's producing good work is fantastic. So just to making that support, knowledge and confidence a reality. And I'm not going to bore you with what personalized care title means or what stratified follow-up means, but it's a good idea to look those kind of titles up, because see how your work links in with those headlines, which is what NHS are focusing on. See how you contribute to that. It's really important to have the language sometimes, and I get lost in it, but there are reams and reams, but there are also summaries of what those things mean. And as I said before, you cannot get more personalized than helping somebody with their finances. So our benefit services are bang on personalized care. So really hitting the strategy of the NHS as well as everybody else as far as cancer. The number one problem in the NHS, time and time again, is communication. So we're talking with Herefordshire and Worcestershire ICS at the moment about how we can collaborate with them to impact that issue. especially between primary care and the hospitals, the hospital sector. So it's early stages of discussions, but what we're trying to invest in at the moment is not so much a bolt-on nurse here or a bolt-on physio there. We're actually looking at the system, and that's very easy to say and very complicated to do. And people have been thrashing about trying to improve it for years. And our poor old NHS is under great strain at the moment. So we're just trying to see how we can invest the very generous donated money that we as an organisation are stewards of to improve things in Worcestershire. So if you've got any great ideas about that, please let me know and I'll feed them into those discussions. We are continuing to fund the welfare benefit services until the end of 2024, which is long-term funding in these days. So great to still be doing that. And we've got some support grants. I'm sure you already know about them, but just in case you don't, we will fund, and this who can apply is cancer self-help and support groups, Macmillan professionals who have access to supporting people like people living with cancer, and voluntary and third sector and community groups. And I've got a long list here of what we will fund. That's things like room hire, refreshments, events like cancer awareness, group outings, volunteer expenses, signposting information, community projects, IT equipment, education sessions, physical activity linked to personalised care. That's why you need to know what personalised care covers, such as prehab, rehab, and wellbeing. And then there's a whole list of what we want support as well. But they're up to £15,000. You don't have to go up to 14,999. But it's about you assessing what you want to do, and then come in, not just saying, I know how desperate it is sometimes to get another bit of money, but the best thing to do is find out what your need is and see if that grant can help you. Thank you very much. Always good to be here.
Anybody got any questions for Tudor? No.
Stunned into silence.
Stunned into silence, yeah. Elaine, do you want to tell us how things are going over in Wyre Forest?
Hi everyone. Yeah, by all means. Not surprising to anybody to know that our frontline service is right across the network is extremely high. And this is all against a backdrop of staff shortages in both recruitment and volunteer. It really is pretty difficult. So meeting demand is really hard. And of course, like everyone else, we're expecting that to get a whole lot worse as the crisis kicks in and more people seek our help right across the spectrum. We are seeing people now daily on a face-to-face basis. We are trying to control the numbers. That's not always possible. As far as the caseworkers on the welfare benefits caseworkers on the Macmillan Cancer Support, they are reporting back saying how difficult their caseloads are because of the amount of clients that are on DS 1500. This is obviously very sad and it's very worrying. This is borne out by what Sally said earlier, a record month in May. There is no indication to think that that's not going to get even higher. And that they are doing an absolutely sterling job. But I do worry about burnout because they are really battling, which I know anybody that works in this sector knows that as well. On a positive note, to end on a positive note, we are expecting to receive another allocation from Wyre Forest District Council from their HSF fund. And when we had the first HSF fund, we were able to help quite a lot of cancer patients with quite substantial amounts of money. That took the pressure off the Macmillan grants, or was over and above what the Macmillan grants were for. So I'm really pleased that we're going to get another allocation, because that proved very, very valuable to us. We were able to help people with heating, with white goods, with essential goods. So I'm really pleased that we will be in a position to offer that again as soon as District Council get their act together and pay the money into the bank. So that's good. Yeah, that's about it really from Wye Forest. Thank you all. I think we're all doing a great job, and the key word here is teamwork, isn't it? And I think this team works fantastically well. Thank you.
Thanks, Elaine. Kate, do you want to add any more to that?
Hi everyone. I was just going to say that I think the clients that we're seeing, the cost of living is really worrying, that the amount of benefits they can get is not going to cover those increases in heating and things. So it's just adding a lot more pressure to them. So we're trying to reassure them and help them access the benefits as quickly as possible, although the delays in getting PIP and things are really, it's really worrying for people how long it's taken. But yeah, just trying to look for everything we can, really, even the few pounds in extra pension credit, or the passport benefits you can get from getting PIP, just making sure we're looking into every avenue to help any way we can, really. Yeah.
All right, thank you. They all do a brilliant job, don't they? Lynn, do you want to give us an update from St Richard's, please?
Hi everybody. My first time on the meeting. Sorry, I have watched the videos of the other, but I started at the end of last year. So in job share with Sophia, just in case anybody doesn't know who I am. I would say, listening to the Macmillan, we haven't had anything like that, obviously, because we're very contained in St Richard's, but I would call it a steady stream of what we're having. We are back doing home visits now, so obviously that takes more time. The cases are a bit more complex, and I would say the thing that we're coming across that other people have already said is the mental health aspect of how long people have been out there on their own and isolated, and late diagnosis, and therefore I seem to be doing an awful lot of special rules benefits for people because of that, I'm guessing. There seems inundated with those kind of things at the moment, actually. And I think Sophia would say again, home visits are definitely the thing that's taking longer. The case is more complex, and mental health is certainly something that she's raised, and a bit of a frustration around carers allowance that took so long. The patient had actually passed away the same week the carers allowance came through. So a real frustration. So that's where we are. We're really just plodding on. Yeah, back to a bit of home working and working in the office. We are still masked in St Richard's at the desks at all time. I don't know that that's going to change anytime soon. So yeah, probably pretty much the same as it was last time, really. Lovely to hear everybody's stories, and that yeah, I didn't know about the young cancer, so I really want to take that back to St Richard's and try to get that for all of the staff in the family support team. That's brilliant. Thank you. Thank you.
Thank you. Lisa, would you like to fill in anything more from what Ben said?
I don't think so, really. I think we've had quite some great from Worcester, but just to reiterate what a fantastic group this is, really, and I'm glad that I've managed to join this morning and listen to all the great things people are doing. So yeah, thank you very much. Thank you.
Okay, thank you. Pam, would you like to tell us a bit more now? You've been in post a little bit longer.
Yeah, so I'm Pam Atanga. I've met some of you before, some people I haven't met. I work for Worcestershire Association of Carers as the end-of-life pathway advisor. For the last year, my numbers have been going up for end-of-life support for carers. So if anybody knows any carers who are out there, you know, with your clients and you think they need support, please refer them to us. It's Carers Week this week, so my colleagues, they're out in various places in Worcester, Kidderminster, Redditch. So if you see any of them and you want to approach, you can have a chat. It's not only end of life. So if a carer who, you think they might not be end of life is, just support, we are here to help the carers. We are the voice for the carers. So the numbers again are going up. A lot of things with the bills, with we have lasting power of attorney is a problem now. Application is taking really long for our carers. So we are trying to get the carers in as soon as possible and give them as much information as they need to know. So they put things in place before it gets to the end when, everybody, there's a lot for them to cope with at that end. And then they have all these other issues, money matters to be struggling with. So as soon as I get a carer, I just have that chat with them and just prepare them. I'm not advising them to do it now, but just know that those are some of the things that they might need to do in a few months' time. And as I said, I've been here now 8-9 months, and the numbers are steadily increasing by the day. But we know that there are still lots of carers out there who need support. So if you come across anybody and you think, oh, we think work might help them, send them my way, and I'll support them. Yeah. So thank you.
Okay, thank you. Joe, I think you're the only one that I haven't spoken to.
Hi everyone, I'm Jo. I'm from the Macmillan Benefits team in Hereford. I think Ruth said most of what needed to be said. Just the fact that we are doing more face-to-face now and home visits. The one thing that I'm still trying to get is the nhs.net email address. Would be really helpful if we could have one of those. I do communicate with other teams, Macmillan benefit teams across the country through Citizens Advice, and some of the teams do have them. So I just wondered if, Tudor, there'd be any way you could help with that maybe, I don't know. But it'd be really helpful if we could have an nhs.net email so that we could send things through quicker to DWP.
You need to turn your mic on.
You're on mute.
Sorry, schoolboy error. I don't know, but I would say Geraint is probably the first point of contact to try and resolve that. But if he struggles, and I've got colleagues who've managed to, their partnerships have managed to do it, I can ask and find out what they did.
Okay, I think we have been trying to do it for some time, but it's, yeah. I think, when I've talked to other areas, they said they had to get support from somebody on the CCG or
because the NHS is NHS and we're not the NHS. That's the thing.
I just wondered if you had any clout.
Not really. You don't realise how low I am in the pecking order. I kind of crawl under stones most of the time.
It would just make our life, it'd be much better.
I'm really happy to support, but yeah, it would be an NHS thing, but I'd be very happy to if they need anything from us. That's absolutely fine, but it would need to be an NHS contact really. But yeah, if you struggle to find somebody, I'll check with people who are across our network.
Thank you.
Okay. Has anybody else got anything to say at all?
Can I just, sorry, Nikki, can I just ask Joe?
Yeah.
Do you know what the issue is, what the sticking point is, or who's been contacted or spoken to?
I can talk to you. I don't know exactly what the issue was, but I say since talking to some of the other projects across the country, they've gone through it different ways. So perhaps we could have a conversation afterwards.
Yeah, and it's definitely viable. I think Healthwatch locally have got an NHS.net account, so it is viable for other organisations, partner organisations, to get them. I don't know the whys and wherefores, but I might be able to put you in touch with someone who does.
Yeah, it's
definitely if we know which route you've gone through first, I'm just not repeating what's already been done. That would be good.
Yeah, I say it's definitely possible, because I say other organisations, they've got it across the country, so that'd be good. Thank you.
And probably a CAB nationally, CA nationally as well, would know, wouldn't they?
Yeah, it was something that we were looking at, wasn't it, Ange, for you, and we never got to the bottom of it. whether it was IT for the hospital or some kind of blockage somewhere there was, wasn't there? Yeah. Okay, everybody. Well, thank you very much. I think we'll be doing the next one probably the 13th of September, if that's okay for all of you. After the summer, have a good break if you can get on a plane. And we'll see you then. Thank you very much.
Thank you. Bye.
Thanks.
Bye.
Bye-bye.
Thanks. Bye.
Bye.